Go.
Nice. It's good to have everybody here tonight, guys. Thank you for coming out on a very stormy night. What could be, you know, the real record maker kind of night. But there's gonna be people watching by Facebook too. So this is gonna go to whoever wants to learn about polypharmacy. And people say, what's that? Well, we're gonna try to cover that. And so I call this class Polypharmacy Just Say No, because I hope that if you have the option to actually take less drugs instead of more, that you at least would ask the questions to make sure that would happen for you. Because I think there's been a promise of the 20th century was actually better living through chemistry, and I do think there's been some amazing things that have been advanced. You can't get rid of the fact that some things that were thought untreatable are now. But when you look at things about the human body, lifestyle always wins. You're never going to go wrong to caring for your body the right way, no matter what you actually want to do with your health, whether it be preserve health, get over an illness, whatever it may be. And so I hope this class will kind of drive that point home that you actually have a lot of control about how your body functions by taking choices and actually asking good questions before you put anything in it that be prescribed or pushed right away. Okay? So I always look for common values. And I always say if you hold any one or more of these values, I think you're in the right place. One is that you actually would like to have some interest in actually in having good health and actually improving it if you can. Is that fair to say?
Yes.
You wouldn't be here otherwise, right? Number two, you understand that in order for things to work, in order for things to change, you have to change. So one of my friends puts it the negative way: if nothing changes, right? In other words, thinking about exercise doesn't change a whole lot, that actually doing it does, right? Number three, positive changes will require some work. And as the saying goes, the only place you find success before work is where? The dictionary. In every other place, work comes before success. You actually put those things into practice. And then we'll talk about this thing about the concept of actually what's in a person's medicine chest, right? Let's just give us an example. You went to your friend's house over the holidays, and you're actually in there, and you're like, man, Grandma's garlic pretzels are kind of hanging around a little bit here. I need to find some mouthwash. You open somebody's medicine chest, and you saw the scenario on the right or left-hand side. You're like, wow, there's a lot of stuff in here. And everything actually here has some type of warning label on it, or it's prescribed for this person, whatever. You went to their friend's house later that night, and you could still taste it. You open that up, and you saw just shampoo and a razor in there. Just by looking at those things, who do you think is the healthier person? Yeah, the person who actually is right, because they have nothing there to chemically prop up their body's function, right? They're taking things, so medicine chest is the term for that thing. We like to see it used for many other things, but the reality is that if you saw a lot of those things in there, you think, boy, that person's having to do a lot of things to change how their body functions for a while. In other words, they're perceived ailments or things that they know they've been told are wrong, but they necessarily can't feel, like high blood pressure. They're doing a variety of things to try and actually change their body's function. And we're going to actually show you what that kind of thinking does to us long term. So polypharmacy is not poly want a cracker, okay?
Aww.
What it is, the definition actually says when a person is being administered several different medicines concurrently for the treatment of a single disease or multiple different medications, and what it does is it usually has coexisting conditions which may result in adverse drug reactions. The CDC actually defines it as actually taking 6 or more at one time, so that's quite a bit, right? I mean, so that means 5 is not polypharmacy. Well, it's still a lot of things there too. And the reality is when you actually take 2, different medications, or let's say you just take 1, it's something your body has to do something with. It actually has to process that to make it effective, and most things actually block enzymes or do various things to your body. When you take 2 or more of them, now it's questionable, like, what is the total effect of the body? Because many times those drugs are studied only in isolation. To see what the effect of a drug is, they actually have to say it does control all the variables except 1. But if a person is routinely taking 5 or 6 different medications, you don't know what that would happen if you put them in a test tube and check them out, right? And a lot of times they find these things out after the fact, like, oh, we should mix this with that because it has toxic effects, okay? USA is number 1 for all the wrong reasons. 6.1 million people have used medications, or sorry, let me back up. The U.S. takes only 5% of the world's population but consumes 75% of the world's prescription drugs. That's a lot, right? That's an awful lot of medication. And so it's probably because we actually have a model that pushes that. Number 2, we actually are a very wealthy nation. So even in some countries where these things might be available, there's a good chance that most of the population can't even afford it. In the United States, between just having decent jobs and actually having insurance, people can afford things that are made available to them, but you have to make sure you make a choice. Now, who actually is taking medication? If you look at this, there's been a huge cultural shift just in the course of 2 years. We went from a nation where a small majority of people did not take any medication at all to now actually where over half the people actually take at least 1 medication. So if you're not taking any medication right now, you are definitely in the minority in the United States. And in fact, that trend continues upward. More and more people are taking more things at earlier ages for a more variety of conditions. Number 2 is who's taking all these different medications. So look at this, prescription drug use by age. You'll see in the younger categories it's relatively low. 18 to 29, less than 30% of people take 1 medication or more, but 27% do, but 73% do not. But you get up to 65 years of age, now almost 90% of people are taking at least 1 medication. No surprise there, right? Seniors are one of the largest consumers of healthcare, no matter what you're talking about, and pharmaceuticals are one of those things for sure. Why are we taking all those different medications? Well, some of them are taken for like a short-term condition. That would be like a bacterial infection or something that happened there. We're going to take it for just a short time to get over something. The long-term things, 34%, that's actually more than, was that 4 times those people like it's a chronic illness. Somebody's had something for at least 3 months or more, it shows no signs of resolving, and the person's taking it on an ongoing basis to ameliorate those symptoms. That's a significant number of people taking those things, all right? What type of drugs are we taking? You can actually see all these things. It's interesting they actually put vitamins and minerals on this list. I find that interesting. They call those medications, but if you take nutrients in isolation, it kind of is like that. And then you see it going up then from there, like antibiotics, hormone contraceptions, calcium antagonists, which are usually, if I'm not mistaken, can be taken for blood pressure issues, right? Mm-hmm. Calcium antagonists. Tranquilizers are things that help us calm down. Respiratory agents for things like asthma, ACE inhibitors. And then you get to the narcotics, which is extremely high there, and lipid regulators, so like your things like Crestor, Lipitor. Things where people have actually been told you have high cholesterol, we need to bring that down chemically. That's what they're taking those things for. And those, again, those are lifestyle drugs. There's no end in sight when you take those unless you actually ask your doctor for lifestyle things. And I actually have heard stories where doctors, I'll give you one quick example. Dr. Nick, who actually worked in our office for 2 years, in his effort to see where he wanted to go for his post-undergrad experience, when he was looking at different occupations, he said, I followed a guy around who was a family practitioner, and outside the room he says, this person I'm going to go to meet with, he actually has syndrome X. He has high blood pressure, high cholesterol, and he actually has high blood sugars. And he could get rid of all those things if he changed his lifestyle, but quite frankly, I don't think he's going to make a change, and I don't have the time. So we're just going to go in here and just renew his prescriptions for another 6 months. And he was like, wow, like you just actually, it's almost fatalistic, isn't it? Like, you won't change, I'm not going to change unless you want to change. So we keep things the same. That's what I'm talking about with that want to change. So how about age, gender, and ethnicity? You can see that, once again, that actually it's well over 60% of people are taking the highest amount of medication. Women take more than men. Why would that be? I can think of a couple reasons.
Birth control.
Okay, there's one, yes. Number 2, who typically looks into their health more?
Men stress us out.
Yes, there you go.
I don't know if that's
PMS, putting up with men's stuff, as they say, right? Yes, and another one too, I think that there's probably still kind of a lingering sexism in things too, like, oh, you must be just a woman, you need some medication to kind of do whatever, right? And then if you look at this too, like, you can see actually the white category is the highest in black and then Mexican Americans, and that's probably based upon socioeconomic reasons, that the health things that we see, I'd say this though, in some cases, some of the people actually have been immigrants, like the people I would see from like Puerto Rico and Dominican Republic in Central Florida, were very healthy people when they would show up here. I mean, low body weight, low body fat, what have you. Within a generation, if their kids picked up American habits, they would actually have the same illnesses we had, sadly, okay? So it's kind of a sad deal that way. And then who are the heaviest users? You can see here, once again, the 60-plus crowd is using the vast majority. If you look at that, almost 40% of people who are over 60 years of age are taking 5 medications or more. That's a lot, right? So well over half of them. So that's really polypharmacy in a snapshot. And lastly, what's the trend in drug use? This actually looks from 1989 through the current year that I had. The use of 1 or more drugs, 2 or more drugs, or 5 more drugs, what's the general trend there? Which way is it going? Yeah, so if your person is invested in your portfolio in pharmaceuticals, you can see why there's been a growing pattern in those drug companies, because more people are taking more things than ever before. A higher percentage of people are taking more drugs for more conditions. All right? How do we get in this mess? First of all, if you're thinking, it's your worldview. If you truly think that the body was designed to be flawed, and that anything that when it starts to break down, you think, first of all, what can I do from the outside to change it? Versus how have I been behaving, right, to get in this mess? Your answer is going to be very different. We always say that the best answers come from asking the right questions. So our patients in a chiropractic office tend to ask questions like, I know my body's actually set up to heal and function normally on its own if all conditions are right, as long as we have proper nerve supply, proper nutrition, proper movement, hydration, stress management. That's the normal state of health. If I'm getting sick, I look at what am I not going to give my body that it needed, or what am I getting too much of, right? Maybe too much stress, not enough sleep, right? That can really happen. A person who has a different worldview is going to ask questions like, what do I need to take for this? What can I take for this condition, right? Number 2 is going to be the plotting. I can tell you guys that this is kind of a sad scenario, that this thing called disease mongering, that actually there's a trend now in pharmaceuticals where they actually try to identify a syndrome, like there's something going on in a given group of people. If we can measure it and define what's normal and abnormal, then if it's outside of that normal range, then we say we have to medicate that. And so that actually is kind of what happened with the cholesterol thing. For a long time, cholesterol was actually not even really considered as far as part of heart disease. It was other things. And then they said, oh, that's the big guy, it's a bad one. We're going to find out what normal is. And if you just see those numbers come down, 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 to now if your cholesterol is over 200, like if you get to 201, and maybe even lower than that, they're going to say, you got to go on a statin drug. And it's like, that never used to happen before. And then marketing, of course, when they go to the consumer and say, ask your doctor about this, try the purple pill, right, or whatever. Now consumers are asking for it. And then lastly, consumers not asking questions. It comes down to the end consumer, the user, who has to say, look, if I'm just going to take these things blindly without asking any questions, that's my own fault, right? But if I ask informative questions and take it with knowing what it's for, what the possible side effects are, and if I have any problems, how I should get in touch with somebody, how to get off of it too, that's a much more intelligent consumer, but most people are not. You said, I was told to take this, I just get it renewed, and there I go, okay? There's two worldviews. Like I said, the outside-in view says that universe and things are they're random, that we break things down into parts, and if I could say one thing about medicine as a profession right now, you know, with the body of knowledge getting so big, with this trend towards specialization is very real. In fact, they even say, I've told, you know, the people leaving med school now that, you know, the real expertise and frankly, the real money is actually in getting into a specialty, which means you learn more and more about less and less until you know absolutely everything about nothing, right? So you have orthopedics and cardiology and hematology and oncology, and so there's all these, they divide people into parts, right? In chiropractic, we look at the body as a whole. We're holist. And so you just go to this list and say, that's quite a contrast in worldviews, but they will absolutely lead you to the things that you end up choosing to do, like fighting germs versus strengthening the host. We've always said, you know, you're around germs all the time. If germs have overwhelmed you, I'm more concerned about making you stronger to fight it off and actually having treating the germs that are currently affecting you, unless it's a really bad one, in which case we have to treat it with whatever it is. There's forces at work you should be aware of. This is actually a great quote. This is actually from the guy who was actually the outgoing CEO of Merck. What he said was, he said he was always jealous of Wrigley Gum because he said they can sell to anybody. The problem with being in pharmaceuticals, we have to sell to sick people. He says, my vision had long been his dream to make drugs for healthy people because then Merck could sell to everybody, right? That was their plan. It really was. And so this thing over here talks about what disease mongering is, where they actually try to find ways to identify a syndrome such as ADD. So the child, if he gets up out of his chair and moves more than X number of times in an hour and actually breaks concentration, things, we're going to label it a syndrome. Well, now if you put a disease name on that, now what can you do? Give medication for it. So Ritalin, Adderall, all these things were actually kind of things we had around that were used to control behavior, but now we have a syndrome we have to treat. And that's really where that comes from, the term called disease mongering. Again, marketing directly to consumer, this shows you how many billions of dollars they will spend in a given year to market directly to you. In other words, go ask your doctor about the purple pill, or take this, whatever. And there's a guy who talks as fast as me at the end who talks about the side effects, okay? We're one of only 2 countries in the world where you actually can market directly to consumers, us and New Zealand. In Europe, can't go on, South America, Central America, Africa, you cannot market to consumers. They go to the doctors first, that's what they do. But we can tell consumers, ask your doctor if this might be right for you. And that, of course, leads to the consumption we have in our country. Okay? So ask your doctor if this thing might be right for you, and you want to ask, why would I need that, right? Like, when they marketed that purple pill, the Dexium thing, most people didn't even know what it was for. They just said, ask your doctor if the purple pill might be right for you. Do you ever suffer from indigestion? Ask them if it might be right for you. And they found out, oh, it's actually not an antacid. It actually changes the way your body secretes acid. And Kenny can tell you about that. This is actually an interesting thing to consider when you talk about taking these medications. This is a sign that the New York Public Department of Environmental Conservation put out that says, if you have medications you're trying to get rid of because they've expired or you're not taking them anymore, here's how you're supposed to handle these things. And they tell you actually put this in something undesirable like coffee grounds or whatever, wrap it all up, and then put it in the garbage, or take it back to the pharmacy you got it from and they'll dispose of it properly. Because why would that be, what would be concerned?
This is dangerous.
Yeah, if you flush it down the toilet, you're gonna give that to everybody. And there actually are scenarios now we've seen now where they're testing fish, because they say that some people are taking antidepressants that you process them and you pee them out through your body or flush them down the toilet if you didn't want to take them. And the fish are testing high for these things in their brains. They're actually finding that things. Yes, they're happy as they're actually losing their ability to actually fight to escape predators now, and things like this too, which is pretty wild, right? Yeah, exactly. And they eat them too. So he catches that and serves it up on a plate. It's like, wow, it's pretty wild, right? So the thing is, okay, so if it's unsafe in those diluted amounts, why would you put it that concentrated in your body? You have to ask that question, like, what would be the possible dangers there too? So whatever you'd see in the public or in the environment in a dilute level is many times over that in your body when you take it directly. Okay. Now here's Kenny's portion. He's going to get into some very specific things on specific drugs and talk about actually where they're being kind of used and the potential side effects and the things you'd want to know about before you took these things, because I've seen this happen in our patient base. For HIPAA reasons, I will not share any names, but I can tell you I've seen some really interesting things happen when people who I thought were living very quality of lives simply had some number that seemed slightly out of whack, and the doctor said, we better put you on this, and their lives completely changed. And so when Kenny talks about these stats, there's real stories behind these things too. So take it from here, my friend.
Sure.
All right. Good.
So I just want to bring attention to some just very common drugs that are there, ways in which the ways in which you treat them, and then side effects for them. So just as I talk or say this, keep in mind this: every disease, pretty much that we have, we don't actually treat the disease, much we treat the symptoms, right? So think about like if you have, I guess we'll start here, high cholesterol. Right, we have different drugs here like Lipitor, Tricor, there's another one called cholestyramine. These prices that I put on here, these are actually from previous years. Keep in mind, I was listening to an article recently, and drug prices in this country have been steadily increasing every single year. Right, so these prices may not even reflect what the actual price is today, unfortunately. But you can be spending anywhere from $34 to $65 per month on just this set of medications, right? These ones obviously they help for high cholesterol, right? The way in which they work is like they cause body to decrease the production of cholesterol, which is not necessarily always a good thing because while your body produces good cholesterol, right? Foods we take in can unfortunately nowadays can be bad cholesterol, but your body also produces that good cholesterol. The way a lot of these drugs work is that they'll actually inhibit your body's ability to produce cholesterol. So that way your overall cholesterol numbers go down, but you're not getting rid of let's say the bad cholesterol that your body's taking in, unfortunately. Right? Some of these side effects, common ones you'll see here, anything from joint pain, diarrhea, common cold symptoms, nausea, muscle pain, insomnia. These are things that are common. Does not necessarily mean that it would always happen, no, but these are things that commonly we would see. Like if you have a patient who's taking this medication and they come in saying, hey, I'm suffering from like diarrhea, we'd be like, oh yeah, we would expect you to take that. And unfortunately, what we would generally do is give them another pill to take. So we give you like an antidiarrheal, so that way, you're not diarrhea from the first effect. And so, and the sad thing with that, because of the way in which these things go, it does create that cycle. Like Dr. Lynn was talking about how you have many people who are taking multiple medications. Not always are you taking multiple medications because of a disease or symptoms that you are displaying naturally. Oftentimes you are starting to display symptoms that are caused by the drugs itself. And so therefore you're taking in more drugs in order to counter or offset this, right? Pretty much as I go through this, right, the next thing, diabetes, same concept there, right? Wherein you have two types of diabetes, type 1 and type 2. Well, actually you have more than two types, but commonly you have type 1 and type 2 diabetes. Right, type 1, we consider that to be idiopathic. We don't fully understand why the pancreas stops producing insulin itself, right? But type 2, we very much know that it's caused by lifestyle. So being inactive, having a very poor diet, will generally lead to diabetes, right? And one of the sad things are, in this day and age, we're seeing a lot more young people who are developing type 2 diabetes, right? And that kind of goes with the way the world's moving, right? Students don't have as much time to play at school, right? And then kids are very much on tablets and phones and computers, electronics, right? So going outside is a very foreign thing. You're like, hey, go outside. And you're like, for what? Like, what's outside? But we take medications for these, and while in some of these, like metformin is like a very first line drug that people take, it can cost like what, $6 a month. But then if you're looking about more expensive ones, like the insulin ones, like Lantus or Invokana, well, I will say it's not a insulin one, but the price for that, we're looking at $408 or $436 a month. Now, if you have insurance, that will hopefully cover a lot of it, but a lot of people can't afford to take these drugs. And in fact, like I said, this article I was watching. I'm actually having my students going to be debating about this next week. But the video I was watching was saying that because people are not able to afford medication nowadays, people are getting very desperate, and they're now starting to go like on the black market to purchase like life essential medication, so like insulin. Right, and it's sad that we're in a state where people would have to go to like a black market to get medication they need. But what's even sadder is the fact that a lot of these diseases are things that are very much preventable, right? And we could, if we make, because even people who have a lot of diseases can reverse them, but because we don't make the changes, because we don't, unfortunately, oftentimes as health providers ourselves too, we don't encourage people to make those changes. right? So it's like, well, yeah, it's, you know, life is tough and you can't afford this medication. Well, that's it. I don't know what else to tell you. You can either figure out or just leave, right? We don't really enforce how to help people to change their life around, right? So, yes, pretty much the way, well, I feel like I'm more preaching than just talking about these things, but the way these drugs work pretty much is that they act to either enhance your body's ability to absorb the insulin that it is still producing, or they just take the place of insulin itself, and so it gives you like external insulin. And then, yeah, side effects for these things, all these things, nausea, vomiting, muscle weakness, nighttime urination, vaginal infection, all these things are symptoms potentially of these medications, right? Unfortunately, because this is one of the weird things that it is, our body is the best system that we have, right? So, for instance, our body produces insulin, regulates it very well. The moment we mess our body up, so that way it's not producing insulin itself, even if you take like external insulin, or we call it exogenous insulin, it does not work as effectively as the one your body produces itself. So that's why you'll see oftentimes a lot of these symptoms that will come with taking these medications, or these particular ones. And then lastly, I want to look at hypertension. This one, as well as like high blood pressure, right? All these diseases that I pretty much showed are actually very common, are pretty much the three most common diseases that we see and that we treat, and that's where most of our money comes from, right? There are other diseases that we look at, but generally high cholesterol, high blood pressure, and diabetes are the three biggest, money makers in our country, unfortunately, right? The drugs, these ones, because it's been around a little bit longer, are cheaper, but to be honest, when you start looking at things and combining the prices for all these medications, I mean, to me, $23 a month isn't the most expensive thing, but I'd rather spend it like on Netflix or something like that, right? Go and watch a movie as opposed to having to spend it on medication, right? So these ones would work by helping, so let's see, these ones work by different ways, but they increase urination is one way that some of these drugs work. So because it gets rid of some of the water, that reduces your blood pressure, but that unfortunately means you have to pee a lot more, right? That's not that fun. Reducing the how many beats your heart actually does. So some of the ways they work is that they'll actually, you're talking about calcium channel blockers. Some of those drugs, the way in which they work is actually inhibiting your body's normal electrical response. So that way your heart isn't beating as fast, right? That will also help to reduce blood pressure, right? But none of these are actually getting to the heart of the matter. That your blood's higher, right? Probably because it's your vessels are being restricted because of the food that you're eating, which is causing the hardening, right, or plaque buildup in your actual arteries and veins, or your arteries specifically. And so your body is trying to be like, hey, it's hard to move. You probably should make a change. But unfortunately, we say, hey, I'm going to throw a drug at it, and therefore it'll fix me. And the sad truth is, with all these medications, the moment you stop taking them, like if you start feeling better, like, oh, I'm great, you stop taking them, you generally have something worse happening, right? You have hypertension, and you start to take medication, you feel fine, you stop taking it, what happens next? A heart attack. So it's not to say it's exactly like one-to-one, but that's what pretty much is happening. Your body is not actually working to change itself, to actually be better. These medications are mimicking what your body would normally do if it could fix itself, right? And so just looking at all these things, to me, it's always sad, because I'm like, why do I want to go down that route? If I can change the way things are about myself, if I can eat a little bit healthier, and I get it's not the easiest thing to do or even to want to do, but when you see the alternative is, I have to now pay a lot of money just for my body to function normally, why would you want to do that? And then here, one thing I know Dr. Lynn didn't talk about, in fact, so that's kind of going through those things. I have a story I wanted to tell real quick, because this will happen. So okay, we've all been hearing pretty much about opioids and opioid addiction. We are finally being made aware of how dangerous it is, right? So about a few months back, I was talking to my mom, and she told me, she was like, hey, pray for this young lady. And I was like, wow, what's going on with her? She's like, oh, she's in jail or prison. I'm not really 100% sure which one, but either way, she's incarcerated at this point. And I was like, really? Like, how? Like, what happened to her? Because when I knew her, when I was back home, so in high school and grade school, You know, a young Christian lady was dating this guy. Eventually, they got married. Were having kids. You know, things seemed to be fine. And my mom told me that she got hurt. She got put on opioids. She became addicted to opioids. And then because she could no longer get it legally, she started getting it the illegal route until eventually she got caught by cops. I don't know obviously the full story, but she ended up in jail for that. And I was like, wow. Like, I've heard of these stories, right? I've heard of them in you know, watching them or online or whatever, but I never knew someone who that actually happened to. And to see that happen, I was like, that is terrifying to me. Like, it's so surreal and so scary to think that because of the way, unfortunately, I say this because this is just the reality, because of the way in which our healthcare system is set up, we push medication on people because that's what will make us money, right? We don't want to actually change cure people of diabetes or cure people of hypertension or cure people of any of the diseases, because at the end of the day, if you cure someone, right, you don't gain money from that. But if you can keep them drugged up, if you can keep them constantly needing the medication every month, you can make a large profit from that. In fact, kind of what you were saying earlier about like how they're constantly trying to find new drugs for people, the reason why they have to do that is because at a certain point you sort of plateau on how much you can make, right? You don't there's pretty much, if 100% of the people are already on medication, how can you get more money is to create new drugs, but you can't create new drugs for the same diseases because everyone's already taking medication for it. So you need to create new diseases so you can treat new diseases, which can give you more money because you have new drugs for people to take. So that's kind of that's where we're at, right? And the only thing that we can really do is be our own personal advocates, right? You know your body the best you know your body better than anyone else does, better than I do, better than Dr. Lynn does, better than any other doctor would ever know. You know your body the most, right? So if you decide for yourself, I don't want to be taking all these medications, I don't want to be spending all this money on these things, then the only thing you can really do is start to make that change, right? And at the end of the day, you save yourself lots of money. So that's a win, right? That's the biggest win. So that's really what I wanted to share. And just, you know, you guys make those changes.
It's been so much fun, guys. Can I finish something real quick? Yeah. So Kenny came to us to actually work in our office for a year, and he actually come out of working as a pharmacist, and he actually, if I can tell a little bit of a story, he said, I just don't want to do this anymore. I just don't find meaning in this anymore to just dispense more things to people who are stepping up and taking it unquestioningly and see this happen. So he really got a vision for what wellness care looks like in a chiropractic office and the things that we teach. And then Kenny went on to try to help change kind of the system from within, and I think he did a lot of good there too, but now he's actually working on training future healthcare professionals. In other words, people who are going through Union College now, getting trained to become somebody. He's actually trained them and teaching them, I think differently, which is really a lot of fun. So it's been fun to see his evolution, the whole thing, and there's nobody I would ever ask sooner than Kenny about anything I learned in pharmacology, because he knows his stuff well. But he's also a huge advocate for patients. Like, look, ask questions, you know, and if you aren't sure about that or whatever, just find out the best difference you can before you do it. Right? That's all we'd ask anybody to do. In fact, I would say most chiropractors are way more open to people just learning about medication before they take it than most MDs are about chiropractic. I've had so many MDs say, oh, you shouldn't get adjusted because of this or like that. I'm like, really? What chiropractic college did you go to? I never went to med school. I had toxicology, I had biochemistry. I know enough things about how some mechanisms work, but ultimately the person who actually prescribes those things knows them best or should know them best. But you need you should be your own best advocate. Go to drugs.com, go to adverseevents.com, look up and see what people really do have for side effects, and ask yourself, am I willing to take that risk at the end of the day? Right?
I'll actually go say no.
You can say if you want to and actually change your lifestyle. So thank you, Kenny. That's awesome, buddy. So last few things, guys. So this is actually, I'm going to pass this article out. This is actually a really amazing study from the, I believe this is, Annals of Family Medicine. So I have enough to give 3 people copies here, actually 2. Yeah, here's one for each. No, I do have one for each of you guys. Maybe I'll give one to Kenny. You guys share one? Is that okay? Yeah, that's fine. So what this is, guys, this is actually looking at how drug therapy is done in our culture in a family practice. They actually went into, I want to say it was either one clinic or several of them, but I'm going to turn your attention to page 456 because they actually have a real-life case study of a patient well-being. I'm just going to read this here. You guys can hang with me here. This is actually the case of Sherry. So we have a 54-year-old female who over the course of 13 years has actually ended up now finding herself taking 8 different medications for a variety of things. So she takes one thing, she drives it with a new condition or side effects like Kenny mentioned of the other drugs, and she's given things. So watch this. Sherry, a 54-year-old African-American woman, is recently unemployed cosmetologist who lost her health insurance several years ago. She's been taking chlorothiazide and a beta blocker for hypertension for 13 years. Right? Once you go on these things, it's considered to be a lifetime drug, pretty much unless you change your lifestyle. 2 years ago, she started taking metformin and glipizide after a random glucose reading of 130 milligrams per deciliter. So normal blood sugar, Kenny is right, is it 60 to 100 or 80 to 120?
It's 70 to 120.
70 to 120. So she just outright, like 10 milligrams out there. And of course, did anybody ask her, hey, should maybe move your body more? No. Do you guys know if you simply followed 4 basic directives, if you actually ate largely a whole foods-based diet, walked 30 minutes a day, didn't smoke, and kept your overweight things under obese, 93% of diabetes would be cured. They actually have shown that in a huge study, 93% less diabetes, okay? So it's a preventive measure because of strong family history of diabetes. After diabetes diagnosis, her doctor used a lower diagnostic threshold for hypertension and for high cholesterol, and she was prescribed a 3rd antihypertensive, so 3 different medications for hypertension, and a statin drug. Sherry is currently taking 8 prescription medications, 3 for hypertension, 2 for diabetes, 1 for high cholesterol levels, and 2 for depression. She's been able to get some of her medications through a county health program that offers generic medications for $6 copay. But she explains, even that reduced amount is difficult for her. Quote, I used to take my blood pressure pills every other day because every time I turned around, I was buying more. And $6 seems like it's not a lot, but when it is when you ain't got it. So she's unemployed, right? She's recently started receiving 3 medications, Norvasc, Lipitor, and Zoloft, through the Pfizer Patient Assistance Program, but she continues to struggle and is now coping with serious adverse events. Her diabetes medications cause diarrhea and bouts of hypoglycemia, which interferes with her ability to leave her home because she must go eat and go to the bathroom so frequently. She's had 5 different visits to the ER in 1 month for excruciating headaches before they were determined to be an adverse event of the additional hypertension medication she'd been prescribed after her diabetes diagnosis. She was able to change her hypertension medication with the help of the Pfizer program. At her most recent appointment, her physician happily told her, quote, your blood pressure is 130/78 and your A1C is actually 7 and your cholesterol is normal. Very good. So what is this doctor looking at primarily? Is he looking at numbers or is he looking at the patient?
Numbers.
He's looking at numbers. Good. These values look good. The person's like, I'm homebound. I have to eat all the time. I'm always going to the bathroom. I can't leave. I'm unemployed. You know, at some point you have to say, what is my quality of life here, right? You know. And again, I can tell you the example of somebody who we know who this really happened to. Like he was an extremely healthy person, was prescribed 1 medication for the thing was out of line, and just I saw the cascade. And he had, if you had a side effect, he had it. If there was one, and it was just so sad. And so I'm just telling you guys that this is not how to see people live. You know, saying, hey, your numbers look great, but you do look terrible. You know, that's a good doctor treats the patient, not the numbers. Okay. Last thing I'll throw in here, Kenny mentioned opioids. It's pretty staggering. Study on the odds of dying based on engaging in an activity. If you actually start driving, your chance of dying in a lifetime are 1 in 103. If you start taking opioids, your chance of dying are 1 in 96, which is more dangerous. Isn't that crazy, right? Like that's really staggering when you think about it. That's from the National Safety Council, guys. So what I'm saying is, you know, this thing I mentioned, Kenny mentioned, where it's somebody he actually knew. I lost a friend of mine to this very thing. As they say, it's an economic downturn when when your neighbor loses his job, but if you lose your job, now it's a recession, right? As they say, right? It's a drug problem. If you hear that some people are dying from this stuff, if you lose a friend, now it's a crisis, right? So hopefully we never get to that point. And if you know people who are taking these things, we have ways of helping them ask the right questions and help get for help. So if this talk has concerned you in any way, guys, if it's actually maybe even caused you to be a little bit scared, it's probably a good thing. There is a solution. One is to break with the old. And who's laughing at the cartoon on the left? Did you see that, Stacey? Yes. The problem is that you're over-medicated. Luckily, there are drugs that can help with that. Okay? Well, we want to go down that path, we can avoid it. One would be maybe embrace the new. There's a study done that said that if a person is actually under regular chiropractic care of any kind, their chance of taking any medication at all is actually down 53%. Why would that be? There's probably at least 2 solutions. Yes, there you go. So proper alignment means proper nerve function, which means messaging to your organs better. And the chance of you actually having organs that are doing their job under all sorts of demands are better, right? Would you say? Isn't it amazing how that happens? It's just the body working the way it's supposed to. Also, do chiropractic patients think differently? They absolutely do. Most of the patients I actually take care of, not all of them, but some would say, you know what, I've been told I have high blood pressure. I'm going to see if I can bring that down naturally. And sure enough, there was one guy, I won't say his name obviously, but he found himself recently retired, and he'd probably become a little bit less active, and he had put on about 15 pounds, and his blood pressure went up. He said, hey, his doctor says, your blood pressure is low. He says, Doc, can I try taking care of some of my own? And he's a very convincing guy. He's got a pretty strong will. And the doctor says, yeah, sure, let's give it 6 months, see what you do. The guy went for 3-mile walks every day, and sure enough, his blood pressure fell normal lines, and within 6 months, he lost 15 pounds. And like, beautiful, right? That's exactly what you want any doctor to do. Let's give it a try, right? You know your body best, okay? So guys, what's your one thing? I'm sorry we went a little bit over tonight, but this is great, guys. I want to make sure you have this chance to do this sort of thing. What is your one thing for you? When you go through this class, maybe you went through and said, you know what? I have been asking the wrong questions. I've kind of fallen back and saying that all this hurts, or I'm just thinking, what can I take for that? There's a good chance that maybe you say, what do I need to act my way out of this? But number two, you know, you could have come to this class, and a lot of times in a class like this, we have people who say, you know, I'm actually doing pretty well. That's great. If you actually look at your lifestyle and say, hey, I'm actually pretty happy based on this, that I'm not taking a lot of medication or none at all, I'm that freakish 48% that's taking no medication at all, well, you're going to be a freak, right? But the other thing is going to be this. If you did a good gut check and saw you're doing pretty well, what about your family and friends? Because I guarantee you guys, if you think about this, if it's not you taking 5 medications, you probably know somebody who is, right? And they're probably not happy doing it. Nobody likes to look at a array of orange bottles start the day and say, wow, which many are taking which one again? And then they get at the end of the day too, right? Those are the people you need to think about talking about. People you actually have seen their medicine cabinets looking like that. Something is not working right. The way the body is supposed to work is not working well, and good chances are their lifestyle is not working for them either. Well, we can't change it all at once, but can we ask better questions, right? Could you ask that person, hey, are you happy taking that stuff? What does that cost you? Do you have any side effects you don't like dealing with? I'm not simply asking you not to be judgmental. I'm simply saying, would you like to actually feel better and live better? And if they say no, well, guys, you did your best. You were the best. You were the best diplomat. I'm happy taking all this stuff, and it's driving my stock prices up in my portfolio, whatever. Great. But if a person says, you know, I really am not happy with this stuff. I'm just taking this out. I just feel like I'm cloudy thinking. It's amazing what a person can do with a little bit of prompting from somebody who really cares about them enough to actually just ask the question. We actually call that carefrontation. You care enough to actually raise the question. If they're willing to make a change, guys, you can teach them a lot, what you learned tonight, but also I'm making myself available as a resource. I know Kenny would too, to actually ask these kind of questions of them too, all right? So guys, with that said, there's our references for what we covered there tonight. And so when you leave tonight, I would ask you just to do 2 things. For the people who are not here tonight but wanted to be, please write on the whiteboard one thing you learned. Okay, we want to make sure that if you have one take home from this thing, please put that down and be a good ambassador for them. Number 2 is, please think about if there's anything that you learned tonight that you say, I really want to have some help with this stuff, but I need some help. Let's have that conversation the next time that I see you. When you come in, we'll have a stop manager. And if we need to have even a one-on-one consultation, we'll do that. And then lastly, think about your friends. If there's something we need to give them, be it a packet on how your body can actually work better, what chiropractic does to improve overall function, or anything that I've talked about in this class, please ask them for them. You can share that article with them, right, about the current trends in family practice using medications and why there's a real cause for concern. Please share that with them so they can start thinking about these things in new ways. All right? With that said, did everybody feel a little bit smarter from being here tonight? Did you learn something? That's good. That means I didn't talk too fast, and you know, Kenny was his usual great self to them too. That's great. So if you did learn something, guys, please apply it to your own life and pass it on to somebody else. With that, guys, we are done.
I have a question.
Thanks for coming.
So if you get put on a medication, I have a friend who got put on like antidepressant.
Yeah.
It didn't work. Obviously, lots of side effects. How long does it take your body to recover from simply trying it for like 2 weeks?
It depends. Yeah, each drug's a little bit different. Antidepressants, I mean, generally they'll wean you off of that over a span of a few weeks. You'd have to look at what the half-life is of that drug, right? Because some of them work differently. They can stay in your body for days depending on them. But usually, if she was on it for a few days and then she got off it,
I think like 2 weeks.
2 weeks.
Say like, you know, you got to build it up in your system and
yeah.
Try it. You know.
Well,
really
after probably about 2 weeks, she'll be fine. She'll be back to normal levels, so where the drug should be out of her system by then.
Okay. That's what I was thinking.
Well, yeah.
Sometimes the effects of putting it in your body.
Yeah, unfortunately, sometimes drugs can cause an effect that it's sort of like the side effect of it is something now that you have to deal with, and that's, like I said, one of those unfortunate things. Some people do process medications differently, for sure, right? Because the way in which drugs are they're tested with a range of people, but it doesn't mean every person's going to respond the same way.
Yeah.
So.
And that class of drugs carry specifically is one that you want to follow the doctor's orders on how do I step down and stuff like taking half a pill and a quarter pill, because what they usually find is that it either doesn't work in the case the person still feels miserable, or they don't like how it kind of flattens out how they feel. Like if you used to have this range of experience, taking medication makes you feel kind of like in this range, and they kind of like they're kind of like I'm kind of like let's say a zombie, but they're kind of flatlining. You know, like the emotional range is different. I feel different on it, and so if they quit it completely cold turkey, boy, it swings back hard. And that's when you get things like Columbine and things like that happen, where people just go like.
Most antidepressants will lead. The major side effect that we look at is suicidal ideation.
Right.
Sometimes homicidal ideation, but it's usually more so self-inflicted pain. But my cousin, in fact, he had I don't know if he was specifically on how or what he was on, but he kept going through suicidal issues. And so he actually tried to commit suicide twice.
Hmm.
So it's just, you gotta monitor those things and really watch them.
So, and then what's your theory on, like, the drug came out as an antidepressant, but it's now off-label prescribed most generally as a sedative to help people sleep?
Yeah,
But-
well, a lot of, because.
But really, if you look it up, I was like, that's an antidepressant, so it's messing with your chemistry, but you're prescribing it for sleep.
Right, so sometimes
Cymbalta
because
is used as an antidepressant and for
and a
nerve
sleeping
pain.
aid, yeah, because
Yeah.
the way in which they work, the different receptors that they affect will lead to
Like
a
Benadryl.
reduction of
Yeah.
Allergy medicine, sleep
yeah,
medicine.
of like the
Right.
reduction of how your body is. So a lot of times they'll like affect like normal serotonin in your body, and serotonin
Yeah.
is more of a like a happy neurotransmitter. So because they lower it, it makes you more down physically,
Yeah.
and just makes you more tired.
But then what if
So-
people take it like it's a sleep aid, whereas, so they don't take it every day?
Right. Yeah.
Is that tricky? Like, I
It's
don't need
it's
it
a
today,
tough
I'm really
thing.
tired.
Generally, like hopefully the doctor who's prescribing it is monitoring the levels. But
No.
it's something that
I only found it out because I researched the med by myself, and I was like, it's an antidepressant?
Yeah.
What?
yeah. It's,
So that, to me, that means you don't just quit it, or you don't just take it one day and
Yeah,
not
tonight
take
I'm
it for 3
tired,
days.
tomorrow I'm not.
Yeah.
Right.
yeah, it's like I said, it's a tough thing. Because of the way some of those drugs work, they knock you out so quickly. That's why they can give it to you as a sedative,
Mhm.
right? Or something for sedation. And the assumption then is it's not going to be in your body for very long. So while it knocks you out, it doesn't stick around too much. So it doesn't
Mhm.
lead to like really altering your brain's chemistry. But like I said, it's a dangerous thing. I personally, my own personal feeling when I went to school and after was I just don't want to take any of these drugs.
Mm-hmm.
But yeah, I never force or like say you can't, but I always say be very wary of what you're doing. So,
Yeah, as a healthcare consumer carrier, like, just to leave you an idea on that one, it's a great point Kenny made up there. Prescribing something off label means you're being prescribed for something that it's not intended for, it's never studied for.
Right.
Like, sometimes we find drugs actually have these unintended side effects, like, was it Viagra was given for
yeah,
to
Viagra's
reduce,
for
to
heart.
reduce blood pressure.
Yeah.
There's this other strange phenomenon, men are noticing that, we're prescribing for that now too, right? Okay, that's how these things happen, these side effects
Yeah,
happen, it's like,
being
okay, give it that.
migraines,
So if it's being prescribed off label,
Yeah.
there's two types of warnings. One is where it's the black box warning, which means this actually has the highest potential to actually have a negative side effect. Make sure you tell your doctor. Then being off label is even more so than that because they've never even studied it yet,
Right.
right? In which case, I would say the doctor should make full disclosure when I prescribe this to you or to your child, because many times medications are never studied on people under 18.
Mm-hmm.
So there's now evidences of people who are under like age 2 being given antidepressants. Well, that's being prescribed off label. That kid was never studied in any type of group, right? 2-year-olds were never studied for antidepressants, kind of thing. So he should say, I'm giving this to you without any, insert saying it should be given for these conditions and warnings. It's never been studied, and you should know that as a patient and the potential side effects. If I do that in my chiropractic office, we really take a lot of pride in the fact that there's some really great research behind the stuff we do here to change spinal curves. But there have been a few occasions where somebody came in and actually had a curve that we had not seen or actually it was not published on. I had to tell them, look, I'm doing something here that actually has never been studied in a clinical setting like this, but it seems to make physical sense, and they were totally fine with it. It has such a low risk in the chiropractic setting for somebody having people do rehab for that thing that hasn't been studied, but it made physical sense, and sure enough, they got great changes with no side effects, right? But I have to at least let them know that sort of thing. If it was too risky for them, I would let them know full disclosure this could happen, right? I think basically, if I told them, I don't know what I told him, but I would say, if I do this too hard, you may actually have sore ribs. That's about it. You're not going to most likely die, right? So, but for a medication that can actually seriously alter your thing, I would want to know, could this actually harm me in some way, either temporarily, permanently, kill me? I'd want to know that stuff, right? Or if I have concurrent conditions with that thing, what could be potentially the problem with that too? Like if a person actually has, say, hepatitis and their liver doesn't process things the same way, that drug is processed by their liver, I'd want to know that thing right away. Because maybe it goes out of my system more slowly, right?
Celiac disease, you have a higher chance of getting seizures, which my friend has had it and been diagnosed with it for like 3 years. And literally, I just read it and informed her that there's a correlation between the two.
Yeah.
Because they put her on anticonvulsive meds recently for some other stuff going on. But
And
because,
if you ever have questions about meds, call a pharmacy and talk to the pharmacist.
yeah.
Because I've had stuff prescribed to me that I reacted to, and they're like, well, that shouldn't happen. They call the pharmacist, and they're, well, that's a cousin of such and such a
Yeah.
drug. Oh, well, I can't take such and such a drug. The doctors, that's not what they go
Yeah,
to school
usually
for.
the MD's office will know what the drug rep told him, the pharmacist
Mhm.
knows the real deal, you know what I mean?
Yeah.
And so, like, in that case where I lost my friend Carrie, this is somebody who I knew who actually had chronic pain from a back surgery she had had done, and she had
Yeah.
gone through all the things, ibuprofen, Tylenol, various things, and none of them were really doing the job for her they needed, so she was one of those areas they first started using OxyContin and things like that, which were being prescribed not off label, well, they were still being prescribed too soon, I think. But in her case, it might have been more excusable because she tried some other stuff, but a lot of people, that's their first thing they're given
Yeah.
after a surgery.
Yeah.
Those were intended to be given to people, a lot of times who had fatal, terminal
Yeah.
cancer, like this kind of thing. Like
Stay
those.
home with it.
And so with those ones, they really have to monitor you because depending on your size, your gender, you will process those things more quickly or as a narcotic.
Mhm.
And so the secret is, can I give you enough to actually change how your brain perceives pain, yet give you little enough that doesn't kill you? Well, in her case, she took enough that actually caused her to stop breathing. Her dad walked in on her as she was taking her last breath, and she coded and they could not get her back at 27 years of age. Well, that to me is not a fair trade. You know, it's just not, like, especially if you're not being told that stuff. That's the thing. So that's why I would just say you want to make sure if it's being prescribed off-label, ask even more questions. What is it normally given for? Why are people using it now this way when it has been tested that way? What can I expect as far as side effects? And then, you know, if I find out it's not for me, I don't like how it's doing to me, is there a way I should be weaning off this stuff if I get, you know, using it where they're all questions I would ask.
Yeah, that's what happened to me. I got sent home from an outpatient surgery with, Percocet and the OxyContin. And like when I came out of my days, and my friend had went and picked up my meds for me, then I got scared. Like, am I really going to be in that much pain? That you prescribed me this drug that I know is a really, really strong drug. And thank goodness I wasn't. And I immediately called and asked for something lower that I knew how it acted in my body and knew that I could taper my weight off of it.
Yeah.
Because I think that's crazy.
Yeah. Two of the
No
biggest.
conversation though.
Yeah. Two of the
Absolutely
biggest
none.
deaths that have happened publicly because of narcotics have been Michael Jackson and Prince, two of the biggest
Oh, yeah.
recorders of all time. Together probably sold 300, 400 million albums in the world. Both of them died from drug overdoses. One, Michael Jackson had gotten to such a point in his career where he actually was taking stuff to wake up and go to sleep both. He was that, affected by things. And then Prince had just actually recently had both hips replaced because all the things he used to do as far as the splits goes and different things from touring and all the things like that. And he was taking fentanyl, which is actually one of the highest addictive, things like that too. And so we've lost these people who have, for them, whether they have insurance or not, no big deal. They can pay for anything they want. They could actually have a doctor show up and say, yep, you need the stuff and write it out. And so that to me it's a real crime when that happens too.
Well, yeah,
When
when
people-
Kayana came out of surgery on fentanyl. So that's what this reminded me
Wow.
of, is to be that advocate. And I didn't know I was going to have to do it way ahead of the game. Like, do not
That's
give that to her.
It's one thing if it's yourself, it's another thing if it's your child or if it's a senior parent too. It may
And just as
feels-
a preventative, like she's coming out of surgery and going to be in pain.
Yep.
Like, really? No.
Get on top
And-
of it ahead
right.
of time.
Yeah.
Which I get, I've been there, but not fentanyl.
Yeah.
Not some synthetic, no.
Good question. So
Yeah.
I just want to make sure you guys understand that we're not attempting to give medical advice. We're asking you to ask medical questions. Just ask the questions and then they give you the advice because they're the ones who do it. I'm simply saying use caution. I'm just trying to think how I would ask questions. That's the things I would ask.
So
Okay.
the drug rep is the one who informs the doctor,
Oftentimes. I mean,
because
it's-
that's what they same thing for the Implanon thing. They're like, oh, it's the same thing as it was 10 years ago. They just put a thing in to where if it gets lost in your body, they can X-ray it and it shows up on the X-ray. But if you look it up, the drugs it interacts with is a completely different list. 100%
Wow.
completely different. Therefore, in my head, that's not the same drug. And the people that I know that have tried it have had really bad reactions to it. So I'm like, really?
Yeah. Well,
It's crazy.
good questions, guys. Thanks for coming tonight and for being part of it via Facebook too.
Ask Kenny if you have a question.
Yes.
Can you get off thyroid medicine?
Can you? Do you not have, did they pretty much just